Good morning, good evening, good afternoon, and welcome to the first webinar in our series entitled Homes, Our Health, Advancing an Inclusive Agenda for Building Performance. My name is Stacey Connaughton, the Director of the Purdue Policy Research Institute at Purdue University, and it is my great pleasure to serve as a moderator for this webinar. Moderating with me today is Rebecca Ochong, the Senior Manager of Urban Land and Policy for the Asia Pacific region at Habitat for Humanity. This webinar series is a collaborative effort between Habitat for Humanity, Penn State University, the Global Building Network, and the Purdue Policy Research Institute. It comes at a time when the COVID-19 pandemic continues to impact lives, our communities, our economies globally, while also exposing the housing crisis. In this webinar series, we hope to provide a space to hear the voices of those most affected, as well as the voices of the youth and voices of people all around the world. We also want to give space for interaction, to provide opportunities for those of you joining to interact with the panelists, with each other, to pose questions and share your insights. Therefore, in addition to Rebecca and myself, we have two chat room moderators, Dr. Peter Masibo-Lumala, who is a visiting scholar here at Purdue and a professor at Moi University in Kenya, and Enid Marcos, Urban Policy Manager for the Asia Pacific region at Habitat for Humanity International. The Q&A option is available to you today, so please post your questions there. We will also have the chat going, so please talk amongst yourselves and with Masibo and Enid. Please keep your questions and your comments coming throughout today's webinar. Rebecca and I also want to recognize and thank Dr. Elizabeth Starkey of Penn State University, who has been instrumental in facilitating the technology platform for this webinar, and Julie Alba of Habitat for Humanity for communication support, Tess McIntyre of Habitat for Humanity New Zealand for her support in reaching out to one of our panelists today, Rachel Swann, and Kate and Krista in the Purdue Policy Research Institute for developing the webinar's brochure. And now, without further ado, let's begin. I now turn the floor over to Rebecca to introduce our panelists for this first webinar in our series, Context Matters. Rebecca.
Wait, please. I'm trying to get, sorry, just give me a minute. Yeah, good morning, everyone. My name is Rebecca. I've already been introduced by Stacey. It's a pleasure for me to join all of you, and it's a very exciting time, especially right now as we come together to speak on this very important topic of housing and health, especially at these times. Now, one of the things that we continue to see around the world, especially now during the COVID pandemic, is the issue around people being encouraged to stay at home in order to save lives. And that really is a message of the moment right now as we seek to prevent further spread of the COVID virus. And normally where for many shelter in place or staying at home means just figuring out the logistics or adjusting your mindsets. And for others, it actually exacerbates the situations and the conditions in which they're already struggling with for so long, especially for the 1.6 billion people around the world who have inadequate shelter, and also the more than 1 billion people who live in informal settlements. Now, this webinar will therefore examine the effects of COVID in the living situations of people around the world, especially the most vulnerable, as well as highlight strategies necessary to mitigate the spread of similar pandemics in buildings and communities. So as we proceed today, I want to take this opportunity to introduce three distinguished panelists that we will have here today. They will all discuss the relationship between key aspects of housing and health and the inclusion of young people as a vulnerable group in the conversations around housing during this pandemic. So first, I would like to introduce Dr. Ester Obonyo. Dr. Obonyo is the director of the Global Building Network, a partnership between United Nations Economic Commission for Europe and Penn State University. She is also an associate professor of the College of Design and Engineering and Design and Architectural Engineering at Penn State University. In 2015, 2016, Dr. Obonyo was a just Jefferson Science Fellow placed in the USAID Global Development Lab in DC. And between 2004 and 2015, she was faculty at the University of Florida, Ranker School of Construction Management. She will share what human-centered building performance is all about. This will be closely followed by Anna Konotchick, the Director of Housing and Human Settlements in the Asia Pacific region at Habitat for Humanity. Anna leads a technical team that supports programs across 17 countries in the Asia Pacific region related to disaster response, resilience, land tenure security improvements, urban planning, housing policy, and housing construction. She will share with us how vulnerable communities across the Asia Pacific region are being impacted by COVID, especially from a housing perspective. Then we will then hand over to Rachel Swann, who is from Fiji. Rachel is only 19 years old, but a very strong housing advocate. She was born and raised in Fiji, and she will, as part of the panel, she will also highlight issues around health and housing, especially looking at it from the youth perspective, and just sharing with us how this is affecting the youth around the world, and especially in her own home country in Fiji. So without further ado, let me hand over to Dr. Ester Obonyo to share with us her perspectives. Thank you very much.
Okay, thank you, Rebecca, for the introduction. And good evening, good morning, good afternoon. Thank you for joining us for our first webinar in the series. So I'm going to highlight a few examples of people who are living in situations that make it difficult for them to do social distancing, or people who are living in places where water scarcity issue prevent them from practicing some of the recommended strategies, such as wash your hands. The picture that you're seeing in front of you is a young lady. Let's give her a name. Let's call her Meduna. Meduna lives in Old Fadama. This is a picture that was taken by my colleague and friend, Henry Bully. Old Fadama is an informal settlement in Ghana. And as you can see, there are so many health risks. In addition to the risk of infectious diseases, the water is polluted, there's risk of cholera, and the list goes on. Their houses are structurally inadequate, they are vulnerable to flooding. So I asked a question to a gentleman who spent a lot of time studying the housing situation from a social science perspective in this area. And his name is Raymond Tutu, and I asked him, help me understand this. She knows for sure that she's putting her health at risk. Is she living in this informal settlement because she wants to, or is she living there because she has to? And I discovered through the process that there is a group of women in informal settlements such as this one who move into the city, and they live in these inadequate structures in the informal settlement because they have to. Meduna is from a tribe in the north of Ghana where the rite of passages from a young girl to adult includes buying utensils. You have to make money and buy utensils, and that is your way of communicating to the community that you're now old enough and mature enough to play the role of a homemaker. So this picture is really about the struggles of a woman who's looking to affirm her position as a functional and a productive human being. So the answer to my question, she has to live here. Even when we provide alternative solutions as people who are in the built environment and we try to move them to a different place, unless we give them an opportunity to make money, then her highest need at this point in her life of demonstrating to the society that she can take care of herself and she can take care of her family is not going to be addressed. And this actually explains why they keep coming back when we relocate them to safer places, or what we think are safer places that don't work in terms of making money, they come back. There are other risks that we know that already exist, especially for people who are in the low income and the poor communities. We know that the houses that they are living in leave them vulnerable. Sometimes it's because of the energy that is being used for different things, depending on where you are in the African context or sub-Saharan Africa. There's a lot of biomass that is being used for cooking, but even in the global north, there are places that people rely on wood fuel systems for heating during the winter. There are some problems that are related to the furniture and the solvents, the paint. And in places, some of the places like Pennsylvania, where you have a very big number of houses that were constructed before 1978, they have lead paint problems. they've managed to paint over some of them, but not all. And even the ones that have had some repainting done, if this is not maintained, the paint is going to peel off. And during this time of the coronavirus crisis, people are being very vigilant about cleaning, and they're using chemicals. Most of those chemicals come with instructions that you need to vacate the room, but we are staying at home, we are not vacating the room, and it gets even more complicated. Some of the chemicals are reacting with surfaces such as counters and also the floor. So there's new chemicals that are being released into the indoor environment. There are problems that are related to building materials, the quality of the water. And then we've also learned that there are certain problems that are about the hygiene of the house, the dampness, the plants that are being used, and then bacteria. And my friend who's a specialist of infectious disease, Dr. James Mutunga, will tell you that we need some bacteria. The problem is when it goes out of balance. So it's within this context that these vulnerable populations are being told to stay at home. This is exposing the risk of several other diseases. Scaling up to the community level, many people who are in the low income category live in places, they live in less desirable parts of the city. We were having a conversation with a colleague this afternoon where she pointed out that within big cities, it may be possible to identify plots of land where we can provide some facilities for homeless people. And I immediately pointed out that if you can find a parcel of land in a big city, it means it's not in a desirable neighborhood. So this is a problem because on the outside, they're probably next to a polluted area, or maybe they just don't have access to green spaces. We are being told, go for a walk. They don't have any suitable place where they can go for a walk. Inside the house, the spaces are not adequately designed. There is crowding, there is noise disturbance, and then it's generally not even very well maintained, especially if it is a rented premise. So because May is the Mental Health Awareness Month, we wanted to flag up that the buildings that are inadequate, that are homes to the 1 billion people who live in formal settlements, or the 1.6 billion in total people who are inadequately housed, many of whom live in cities and other urban areas. They have some psychosocial health problems that are not being adequately addressed. And the buildings, by not being designed to perform to the highest standards, are contributing to this problem. All in is a phrase that is also being commonly used. And I would like to know, what is the strategy for inclusion? If you look at the representation of people who are mostly impacted by poorly performing houses in the entire process, starting from the design of the building to construction and maintenance and even demolition, if that is ever done, they're not there. The people who are mostly impacted by poorly performing houses are not included in the decision-making process, and this is a problem. I had the privilege of participating in a couple of community engagement events at Pittsburgh, and I was pleasantly surprised to see statistics such as in the United States of America, the percentage of Black women who are in the profession of architecture is as low as 0.3%. You can look at all the other professions, engineering, construction, name it. I've had the opportunity to work in the industry, both here in the US and in other countries. We are not many. This is a problem. All in is based on the premise that everybody has a forum through which their voices can be heard, and this is not happening. The crisis that we're in is amplifying this problem. I'm sure you've all attended very many webinars, and you'll agree with me in my statement that the people who are mostly impacted by this problem are not being engaged in any meaningful manner, and this needs to change. The buildings that we've been constructed are often based on the premise that we're designing for an individual or a family. We have shifted people further away from the sense of the community. I am actually very guilty of this. I live in a set of townhouses that have not been designed and constructed with the community in mind. I don't see my neighbor. I've been living here for 5 years. And this is a problem because we know that the most effective way to get the information passed from one person to another is through getting people to talk to each other in informal settings, especially within the context of a neighborhood. We know that the most effective way to initialize behavior change of any kind is through these small groups at the neighborhood level. We know that when neighbors talk to each other, all the other social determinants of health that work alongside housing to ensure that everybody is reaching their full potential can be better addressed. We have examples of these models. We have the co-housing model that was established in Denmark and has been replicated in other places. If you talk to my contact, Mukunda, he's going to tell you that sociocracy has been used to set up villages in many places of the world using this small group neighborhood approach, trying to sensitize people by starting through meeting them at the point of their needs and ensuring that everybody's okay. There are vulnerable populations whose needs have been met at a much higher level through this arrangement that take us back to this sense of community. The senior people, senior citizens, people with special needs, the people who are also chronically ill and they are homebound. We also have people who have disabilities and are not able to use the spaces that are designed using a one-size-fits-all approach. Life is about choices, and the way we get to the choices matter the most. And I contend that if our buildings start to create spaces where we can have shared experiences, if our buildings are designed and constructed to create community spaces that allow us to shift back to community engagement at the neighborhood level, we will have a much better chance of responding to crises such as the corona crisis. This is a picture that was taken by my good friend, Marlo Novino. Marlo Novino came to us at Penn State through the US Department of State Young Southeast Asian Leadership Initiative. He took this picture on Sunday and he labeled it "Calm After the Storm." And it is a lovely picture. First of all, it's encouraging for someone like me who works in the built environment that we know how to put up structures that can withstand a storm. If you're not aware, the Philippines was hit by a hurricane on May 14th. This story would sound really nice if we didn't know that we have at least 34,000 families that have been displaced by this recent typhoon. And there's another one that is expected to hit actually today. There is a problem. We know how to design the physical building, but the benefits are not being extended to every single family. It takes roots to weather the storm. We need to shift back to the person, to the communities. The buildings that we are currently designing do not work, not for everybody. They are not environmentally sustainable. There is not a single place across the globe where people can say that our buildings and our homes, our houses are performing to the highest standard possible. They are not good for our human health. It is time for people in the built environment to embrace all the other social determinants of health and focus on the person. Thank you for listening.
Yeah, thank you very much, Esther. Thank you for your presentation. It's good to see how you highlighted some of the challenges the most vulnerable continue to have as in their daily lives, and especially right now with the COVID situation, how that has even been made worse. And I think your final remarks in terms of the calm before a storm, I think it's something that here in Asia Pacific we really relate with. It's one of the most disaster-prone areas in the world, and yet at the same time we also have a big population of people who still live in inadequate housing. So with issues like cyclones and typhoons, as we speak right now, there's one going on in India and in Bangladesh. Already people who are already sheltering in place, and then they had to leave their places. They're supposed to be quarantined, but then again they cannot because of the ongoing disaster that is happening there. So really, this just goes to show how the importance of the kind of buildings that we design, the ones that we deconstruct, how do we ensure that it embraces everyone? So thank you very much. I will now hand over to Anna Konotchick for her presentation. Welcome, Anna.
Thank you, Rebecca, for that introduction. And thank you, Esther, for your talk. I think it really lays nicely a lot of these issues that we're grappling with also as practitioners. I want to start by introducing myself. I'm also an architect, trained architect and urban planner. And I'm happy to see that there's so many interested architects, engineers, and kind of technical people interested in this topic. When I was in academia, I had a hard time finding my peers. So really exciting to see this interest. I'm also very happy to say that I'm on my first Womano. So pleasure to be presenting with you, Esther and Rachel. So as Rebecca has mentioned, I'm working with Habitat for Humanity in the Asia Pacific office. And I do just want to mention that Habitat for Humanity has a historical founding in grassroots inclusion movements in the United States, particularly in the 1960s during the segregation era, where our founders were trying to create exactly this kind of model community of where we can bring together what were communities that were meant to stay apart and try and create this more kind of utopian image of what it could look like when we come together, help each other out, and help create a home and community together. And I just want to share that background because inclusion really is at the heart of the work that we do, as well as kind of making sure that we're listening to communities and kind of supporting their goals and visions for this work. So to switch over to COVID, I like to start on this photo from Phnom Penh, in part because it highlights some of the issues that Esther already raised, which is the kind of foundational challenges of economic inequality and social inequality and political inequality that underpin these health outcomes, particularly in a pandemic like COVID. So you can see in the background, kind of wealthy condominiums being constructed. Meanwhile, you have this informal settlement with overcrowding, poor ventilation, poor sanitation and water facilities, and of course, poor health outcomes because of that. So with COVID now as a global pandemic, it really is kind of highlighting these particularly these sort of inequalities. And in the Asia Pacific region, the impact of COVID-19 is even, will be felt more in part due to the concentration of economic activities, demographics, and urbanization. The region is home to the large concentration of urban poverty, with 1/3 of urban dwellers living in slums or slum-like conditions, and 1 billion people without access to proper hygiene, water, and sanitation. So wanted to start, is my slide advancing? There we go. The way Habitat is responding is that we're trying to ensure that that we are committed to a world where everyone has a healthy place to live, to help contain the transmission of COVID, and that are not forced from their homes due to economic hardship caused by COVID. And that really highlights how we are understanding this emerging crisis, which is a dual crisis, a health one and an economic one, where we like to kind of use this quote from Leila Farani, the UN Special Rapporteur for the Rights to Adequate Housing, where housing has become the frontline defense against coronavirus, and home has rarely been more of a life or death situation. And I think Esther did a great job of explaining why that is. The economic crisis for us is also quite important because it underpins those kind of economic inequalities as well, where potentially a family hasn't been directly impacted by contracting COVID, but they're still forced from their home, lost their jobs, and are now more at risk due to COVID. And so the way that we're seeing in Asia Pacific, particular communities that are at risk, as I highlighted at the beginning with that photo from Phnom Penh, it's particularly families living in dense informal settlements with poor access to infrastructure. While the numbers in Asia Pacific for COVID are still relatively low, that's also because and much of South Asia, it's still on the incline, and also much more strict containment measures than a lot in the West. And these dense informal neighborhoods is where there's the highest risk and a lot of efforts going in to try and prevent spread. Other ones are renters who are at risk of eviction. They may have lost their job, they're not able to make the next month's rent, or there might be frontline health workers, and the landlords are kind of worried about them bringing back coronavirus to the building. Women in particular, we are seeing a rise in gender-based violence due to poor quarantine sheltering options. So overcrowding of families, exacerbating challenges within the family. Also, participants in the informal economies that don't have adequate safety nets, they might not be getting any support for unemployment, or they're probably working with poor health and safety regulations. And that in particular includes construction laborers as well. Obviously, frontline health workers, the elderly, those with underlying health conditions, people living with disabilities, and also people in disaster-prone countries. Wanting to kind of focus in, this is a photo from Bangladesh, from Dhaka, and just wanting to highlight that the challenges of health as it relates to COVID is really predicated on systemic challenges in the housing sphere. And so we see this, there's both a lack of investment. I think it's something about $14 trillion that will be necessary to invest in affordable housing that was estimated by McKinsey in order to address the affordable housing gap worldwide. That's a mind-boggling number that no government has, and so it really does require innovative partnerships to try and address. So already that was a pre-existing challenge. There's also poor policy and government environments. They might not be addressing the needs of the most marginalized or vulnerable, and also broken market systems. And I mention that because about 90% of that $15 trillion needed for affordable housing is probably going to come from the private sector. And right now, the private sector in the affordable housing arena kind of ignores the bottom 10, 20%. On top of that, all three of those things are layered upon historical injustices and pre-existing inequalities. And so it's only exacerbating what had already existed previously. While we see the safe and secure home as a first line of defense against COVID, it really is layered upon that more kind of systemic understanding of how we can address that longer term. So within Habitat, we're trying to understand that it's both the immediate things we can be doing to try and address that, as well as kind of the longer term systemic things we need to be addressing for the longer term recovery of these families affected by COVID, but also to help in the resilience against future pandemics. And so while we have kind of immediate needs, such as providing kind of hygiene improvements in households, either through kits or through kind of small upgrading opportunities, maybe installing hand washing stations or kind of expansion spaces for families to reduce overcrowding. Other options in terms of trying to address particularly the most at-risk communities, such as frontline workers, by providing temporary shelter accommodations and also trying to minimize their evictions. And we're also trying to find other ways of stabilizing conditions for low-income families by providing direct financial assistance. And so that can be things like immediate direct cash transfer programming. If their finances if they've lost their informal job, that you can kind of help them pay rent or help them, buy food so they can continue to maintain their house. But I really want to kind of highlight that all that, while we're doing that kind of immediately, what we see is critical, and what actually Rebecca leads for us in the Asia Pacific region is this foundation of advocacy. So you really, in order for us to be reaching the scale of need, the 1.6 billion people globally that have inadequate housing, but also just even within Asia, we need to be thinking about how we're using our voice to highlight government's responsibility to assure adequate, affordable, secure, and healthy housing. So I would be remiss not to raise what are compounding crises. As previously mentioned, as we speak, there's a Category 5 cyclone hitting Bangladesh and India, Amphan. And it's basically, when you look at the satellite image, it's the size of Bangladesh that's hitting it right now. And so the way that you save lives is bringing people into eviction centers because their homes can't withstand these sort of impacts. And so I give the example of the Philippines, where they, similar to Bangladesh, have recurring natural hazards, where Harvard found that 40% of Filipinos' homes nationally in the Philippines have been damaged by a natural hazard. And I'd like to give the statistic of post-Haiyan, whereas we might think that through humanitarian assistance and some of those kind of immediate activities that I mentioned on the previous slide, that we're actually hitting that need as a sector, as a humanitarian sector, and that's just false. As an entire humanitarian sector, government, NGOs, and everybody, post-Haiyan was only able to reach about a third of that caseload. And I'd like to highlight that because it really shows just the huge need that exists for housing and shelter, particularly post-disaster. And now we'll be having this exact same challenge in Bangladesh in the coming week. And how do we try and do that when both mobility to those areas, as well as but for the government as well as for nonprofits is minimized. The other thing I would mention is that it's a compounding crisis, but to me, it's also kind of parallel experiences. A lot of what we're seeing in the pandemic mirrors what we see during natural disasters as well. I usually don't like to use the term natural disaster because it's a natural hazard that's playing out over uneven historical contexts. And it's those previous injustices and changes in context that make it a disaster. It's not the natural hazard in itself. And so similarly to that with the pandemic, it's not necessarily COVID in itself, but it's the inadequate housing and living conditions and the historical injustices of why certain communities have to live in more polluted areas or more at-risk areas that make it a crisis and a real disaster, not the disease itself. And so I like to kind of provide this one example of one way we try and kind of bridge the gap between immediate needs as well as looking at those issues more systemically. And this is an example from Battambang, Cambodia. And while not COVID related, I've not been able to visit there since then. This is an example of a woman who was physically disabled from landmines after the Khmer Rouge time, and she was also a refugee during the Khmer Rouge time. And so after the fall of that regime, came back to Battambang, settled on public lands, and lived in really substandard, informal conditions. And so as part of that, there was the immediate need of, particularly for a community that was kind of marginalized, literally on the margins of the city, on marginal lands, but also for particular families that are more vulnerable, like this woman who had kind of challenges with, employment options given her disability and that sort of thing. We tried to address immediate issues like improving the housing quality in terms of building her a new house and supporting her with other things, and you can see her in front of the house. But also at the same time, that was part of a government land kind of readjustment pilot for their new national policy of trying to figure out how they can help to address families that live with insecure land tenure. So really it's particularly families living in those precarious land tenure situations that are the most marginalized. And so this was used as part of this case and pilot with the government to be able to expand for national application. And so I like to give that example because it was also based upon working really hand in hand with this community and the local community groups, as well as with groups that were specialized in working with people with disabilities or people living with HIV. And we were really learning from them on what they needed and how we should be kind of raising their voice and their needs within that government policy framework. And I think as organizations and individuals, that's kind of an onus of a responsibility for us to be proactively searching for these groups that are kind of fighting this fight on behalf of these communities and trying to support their vision and their fight as well. So that's one reason why I'd like to kind of begin to close on with that example from Cambodia. But just want to mention that with COVID, it really is a moment for us to take a step back as a sector, academic practitioners and humanitarians, to rethink about what housing means post-COVID. I think it'll challenge urban planners to think about how cities are even planned and developed. But hopefully it also challenges architects, engineers as well, in terms of what does housing mean, what does infrastructure mean, who are we designing for, and that sort of thing. So just this graphic tries to show that it's all connected into one kind of system, and you can't really ignore any one of these points. That we really need to start by understanding that context, what that local capacity is, who are those people who have that vision that we should be partnering with, and where are the resources and how can we kind of help to influence that. It's important to be really thinking, while we're trying to address those immediate needs, we're also thinking of what that broader systemic approach to healthy and resilient housing is. And kind of finally, that last point is probably the most important for me, and the fact that it starts with people. Public-private partnerships are critical, particularly in a context like Asia, where the economy is actually quite active and booming, and it's not necessarily for lack of resources that you see these challenges. It's the unequal distribution of these resources and power that have made these poor living conditions. And so we do need the private sector there. That is part of it, and that they are that 90% of the funding to get to adequate and healthy affordable housing. But we need to be making sure it's people-centered and really making sure they're there at the forefront, and that we're accountable to their vision and supporting them. So for me, that last point is really the most critical. So with that, I just want to thank you all for taking time to join us in this, and I hope with the next webinars also we'll be able to have some of my colleagues get into more country-specific examples. But just want to say I'm inspired by your work, Esther, and also by kind of young advocates and like Rachel that will be speaking next. And thank you for inviting Habitat to join you today. Thanks.
Yeah, thank you very much, Anna. Thank you for your presentation. And again, your presentation again just continues to highlight some of the challenges, especially the most vulnerable have. And again, you've also just highlighted right now, again, the compounding effects of other disasters that continue to face us as we speak right now in the Asia Pacific region, the cyclone in Bangladesh and in India. So again, of course, this just goes to show how this is an urgent issue that needs to be addressed, because the disasters will continue to happen, other pandemics will happen, and are we going to go through the same cycle? So again, thinking post-COVID, what are the longer term sustainable solutions that we need to have, looking at it from a systemic level, what kind of partnerships can we have, what kind of resources do we need, and et cetera, in able to address this. So as we move forward, now from Anna, I will hand over to Rachel Swann to share her perspectives, especially from youth perspective, how they are dealing with the housing and health issue, especially at these times. Welcome, Rachel.
Hello, everyone. Nisam Bulavinaka, warm greetings from Fiji. I first wish to express my appreciation for this wonderful opportunity to participate, despite it's been a bit of a challenge, especially with the network and with COVID-19 currently happening. Owing to COVID-19 and its unfolding impacts across the world, this is now a time of tremendous uncertainty. The people of my region, the Pacific region, the COVID-19 pandemic has compounded our existing issues. For Pacific communities, climate change and its impacts are our biggest threat. The rapid rise in sea levels and saltwater intrusion are a daily challenge for many island communities, making land uninhabitable because the soil in these affected communities is no longer suitable for agricultural purposes. The internal displacement of communities due to sea level rise continues. On top of this, we're faced with extreme weather patterns, warmer temperatures and frequent cyclones with increasing intensity. In early April, just as the Western Division of Fiji was under lockdown due to COVID-19, Cyclone Harold, a powerful Category 5 cyclone, swept through Fiji, wreaking havoc and destroying villages and displacing families. Cyclone Harold also caused devastating damage and the loss of lives in the Solomon Islands, Vanuatu, and Tonga. Cyclone Harold and its path of destruction could not have come at a worse time. COVID-19 border restrictions severely hampered access to much-needed disaster response assistance from humanitarian agencies. For many families who had lost their homes, crowded evacuation centers became the only option, despite social distancing precautions, thus increasing the vulnerability to the virus. Though the Pacific region as a whole and my own country have reported low numbers of COVID-19 cases, we are not immune to its impacts. As a result of border restrictions across the globe, our small-based economies have been hugely impacted. The Pacific nations are hugely reliant on the tourism industry, which has now come to a standstill. Hotels and the many industries which feed off tourism have ground to a halt, leaving thousands without jobs, and the employment numbers are expected to rise as the pandemic continues. Prior to the pandemic, employment opportunities were minimal. At the end of 2019, the Fiji government had hoped to reduce the unemployment rate from 4.5% to below 4% by 2021, many of whom were youths. The government had stated that the key strategy in finding employment for the unemployed was to grow the economy. This, unfortunately, will take some time under our current circumstances. Our current economic situation will now mean that we have to be more creative. The Fiji government has always encouraged self-sustainability and entrepreneurship. There is no better time than our current times to put this in action. For Pacific youths, it means going back to the ways of our ancestors, using our traditional knowledge and our traditional skills and adapting them to our current times. We are seeing evidence of this in our communities, most especially in the urban areas. With the delay in urgent cyclone relief, locals are raising funds for building materials for displaced families, in addition to sending food, clothing, and cooking utensils where they are needed, thus filling the space of humanitarian agencies before much-needed relief supplies could arrive from abroad. These goodwill initiatives have continued into assisting the families of those who are no longer employed or who are facing pay cuts due to the impact of COVID-19. There are now many more families struggling to put meals on the table. A local Facebook group in my country called Barter for Better Fiji has become extremely popular and has featured on several international news pieces. The group began just over a month ago with now just over 150,000 members. The group encourages the exchange of goods without cash, bartering, trading in much the same way that our forefathers did. Through the group, we have seen stories such as young people from villages bartering with people from urban areas with fish, root crops for groceries, baby items, and electronic goods. And a group of 6 young men who call themselves K9E Brothers, who are unemployed, who are now unemployed. They consist of tourism workers and tradesmen, and currently they offer their services in exchange for groceries. They have received so many offers to barter their services for groceries that they have begun distributing additional groceries which they receive to other struggling families in their own community. These are a few of the heartwarming examples of how youths are reacting to the current pandemic in Fiji. I encourage you all to take a look at the page. It has been great to see so many youths involved in this initiative. Groups such as this provide a sense of unity. And I'm encouraged, as some other youths are, to see that there's also a strong sense of hope in our communities. Through this page, we have seen similar Facebook groups set up now for communities across the Pacific, in Vanuatu, Tonga, Samoa, the Solomon Islands, Australia, and even in New Zealand. So this has been extremely encouraging to see it catch on. For Pacific Island communities, a large number of our youths live within communal, extended family settings. This is predominant in rural island communities where living with extended families is the norm. It is also prevalent in the urban areas where rent is high and several members of an extended family live together and share the cost of bills. Here, I'm talking about 10 to 15 people in a 2 to 3 bedroom home. How this isn't unusual in the Pacific. In Fiji, it is within these settings that living under COVID-19 restrictions has become quite difficult for youths, where social distancing and national restrictions require that people remain at home. In Fiji, youths thoroughly enjoy a game of touch rugby every day, or swimming at the local beach or river, or football at the local parks, all of which were heavily restricted due to COVID-19. For youths that live in homes with extended family, the inability to enjoy this daily escape has been somewhat stressful, evidenced by the number of youths arrested for COVID-19 restrictions in my country. An example, on a single afternoon here in Suva, 39 youths were arrested for playing rugby on a beach. With no release for pent-up frustration and the stresses and worries of life, it has been of concern to health authorities, and we have seen constant reminders about toll-free phone helplines in the media for professional advice. Pacific people and our youth tend to be extremely resilient in the hardest of times. The traditional support systems and cultural systems tend to provide a sense of security, and this has been evident in the way that multicultural communities here have come together to assist one another during this time of hardship. People are going back to the traditional ways. The youths are relearning the ways of our forefathers. The Government Agriculture COVID-19 Response Initiative has been hugely successful. The distribution of seed packages has given purpose to youths who can now see that living off the land is a possibility, especially as there has been so much emphasis on white-collar jobs, office work, as opposed to farming amongst Pacific families in recent years. Strangely enough, I might add, is that those youths in the rural areas and in the islands that are living life as usual, the urban youth are perhaps the ones rediscovering the traditional ways by going back to the land and sea for our food sources. Housing is essential in a person's life as it enables one to have a sense of privacy and security in order to safely raise their families. It is the starting point of any individual in which they're influenced to perceive the world based on the influence of the family's psychological mindset and their environmental surroundings. However, due to these unprecedented times, many communities are facing hardship during the ongoing COVID-19 pandemic. Many nations are spreading awareness on the importance of social distancing measures in order to slow down the spread of the virus by encouraging everyone to stay at home, practice social distancing, and self-isolate. A home can now be seen as a sort of defense mechanism that people need in order to minimize the progression of the virus. Yet, housing initiatives are still required. This is where the work of Habitat for Humanity is so important. In the urban areas where housing is an issue, and we may start to see an increase in informal settlements, the local NGOs and faith-based organizations tend to fulfill a large role in assisting amongst these communities. Through the university and the church and sport youth groups, organizing assistance has been a regular initiative. However, in such times where gatherings of more than 20 people have been restricted, this has been difficult to organize. Perhaps that is why, as mentioned earlier, the online organization of assistance initiatives in communities in need has been quite successful. The tech-savvy youth have been quite constructive and have fulfilled an important role in these difficult times, and it is evident that the government and our local communities have recognized this. Utilizing the skills, energy, and intelligence of youth is the best way to engage us. Vinakavak level, and thank you very much.
Rachel, thank you so very much. You know, your message, I think we all share the sentiment, brings us great hope, as does your persona. So thank you very much for your message today. We have had just some wonderful questions come in over the course of the panel, and I'd love to begin to give our panelists an opportunity to address them now. Our first question is to Esther. Esther, COVID-19 has threatened social cohesion, which is important for mental health. How do we capitalize on social media to encourage people to stay connected and build healthy relationships during this pandemic?
So I actually am going to defer to Rachel, because this is linked to something that she said in one of her last, during the last few minutes of her talk. Rachel, how do we take advantage of social media to help people stay connected?
Sorry, could you repeat that again? Sorry about that.
During your presentation, you made reference to young people and how they are technologically savvy. So I'm hoping that you can build on that to help the rest of us who are late joining social media. Some of us are still frightened of Twitter. So now that we are in this situation, how can we better utilize social media?
Well, we can better socialize, socialize with social media with youths. In a way, like for families, they kind of build the bridge with families, with like families that aren't using social media because they might find it difficult. Youths are able to explain and encourage others, because I think people don't realize that technology is a powerful tool, and also with COVID-19 currently happening, in order for people to communicate, technology is vital for everyone. So by sharing and also ensuring that misinformation, especially during this time period, misinformation is minimized, youths are able to share and help everyone, and also everyone can come together and help and during this difficult time.
Rachel, thank you very much. All right, our next question is for Anna. The question says, the reality you find in housing in cities, especially as a neighborhood of the rich, surrounded by a slum for those that serve them. As indicated in your presentation, it's important to engage people from all walks of life to determine the kind of housing that works for all. How do you see creating a space that serves people from these extremes of the economy in a way that centers on their humanity and their needs, as opposed to their economic abilities and differences?
Hilda, that is very well phrased. Thank you. I think just the way you even frame the question gets at the real crux of the issue. Is we have increasing inequality, and it's particularly those in power who are benefiting from the status quo. And in reality, we do need to be working with those in power to make sure that they're helping us to change that status quo. And so for me, one of the messages I was hoping to get across, and what helps at least personally keep me kind of inspired in this line of work, is recognizing that there are really impressive local groups like Rachel, gave the example from Fiji, and for groups that maybe have more agency and more I wouldn't say agency, more influence with these powerful government agencies or private sector actors. I think I think Habitat for Humanity, I think we kind of fit in that, where we have an ability to, in the US Congress, talk with our representatives, but also similarly in different countries, maybe have an ability to talk with national governments that others might not have. And so I see it as an incumbent upon us or other agencies like the UN to really be proactively reaching out, being humble in our engagement with these local groups, and and understanding it from their perspective. The other thing that I think is critical, and I was happy to hear Esther start the conversation on that note, is I think it requires a common understanding from everybody engaged in the conversation of what those power dynamics are, and our complicity in that process. And so I think with every actor if we can all lead by example and try and encourage that in others in terms of trying to understand what our complicity and what our position is within those power dynamics, I think we can start to create a space of dialogue that will be a little bit more equal, that we can try and make sure that we're bringing together the voices that need to be at the table, and making sure that they're receiving the attention and the time and the credit that they deserve. So I mean, that's kind of a really broad way of kind of saying it, but to me, it's really about those political dynamics.
Thanks so much, Anna. You know, this next question, actually, any of you, Rachel, Esther, or Anna, could speak to, and that is Ajay is wondering, has any city taken the initiative to reduce overcrowding in low-income neighborhoods to reduce the risk of COVID spread in communities?
I'll start, and then Esther, you could go since I'm off mute. From my knowledge, I don't have any city governments off the top of my head that are doing this. Our examples that we have been working with are more around smaller local groups that focus on, for example, women who are being who are experiencing increased incidents of violence against domestic violence due to the COVID quarantine conditions. And so working with those local groups to find alternative sheltering options that are, in effect, it's reducing the overcrowding at the household level for those individuals. However, I raised that point in my presentation in part because even if it's not happening, I think it's also the responsibility of us as actors in this ecosystem to advocate for governments to be addressing that, even if it's not that immediate activity that we're doing today, and is critical for ensuring that we are resilient for longer term healthy communities and houses.
Yes, so I'll add, since Anna invited me to talk. So thank you, Anna. So I agree with Anna that at least I can say, to the best of my knowledge, I don't know any city, because city is big. I don't know any city which has been able to resolve the problem. I think they're trying and their heart is at the right place. And as Anna has shared, we are hoping that through creating these forums where people can tell their stories, we are going to start to encourage some of the resources that only the government and the private sector can provide to be channeled towards this need, because we all know housing is expensive. And these interventions will require way more than a university or a set of universities working in collaboration with Habitat for Humanity to resolve. So our goal really through these conversations is to try to bring attention. They say in Alcoholics Anonymous, for example, the first step is acknowledging that there is a problem. And in this case, we want to acknowledge that there is a problem through giving the people who are affected a chance to also heal. And we think that if we just continue doing what we've done before, which is relocate people or promise people that if you move temporarily, we will provide a better housing situation, those have not worked. So we are now advocating for co-creation. Let us work with the people. There is injustice that has happened. There's been discrimination. The housing sector has inadvertently contributed to this problem. There is healing that needs to happen. And there is also a raised awareness in terms of the evidence that will help policymakers to allocate the resources that are required to address this problem at the city scale.
Thank you so much, Esther. We have time for just one more question, and it is for Rachel. Rachel, Julio types, I think this idea of thinking the house as a defense mechanism is very smart. How are you imagining houses in your community should be in a post-COVID-19 future?
Excuse me. Well, I think in a post-COVID-19 future, personally, I think that it might be the same before COVID because of climate change and what's currently going on, and because of climate change, I think because we're a developing country, developed countries need to do their part and help decrease carbon output, and because sea level rise and displacement of communities will continue, because that's the Pacific reality. And I think also just because of what's currently happening with the COVID pandemic in small island nations, I think post-COVID, it's essential for all nations in the Pacific to look with the current situation and learn from their current mistakes and improve, so that we can be resilient in the future for any other global crisis that may affect small nations in the Pacific.
Rachel, thank you so much. Rebecca, back to you.
Yeah, thank you very much, Stacey. Thanks everyone. It's really been great being with everyone here today. Thank you very much, the panelists, Esther, Anna, and Rachel. Your contributions have really been great, and all of it, again, just goes to show the importance of this issue that we're talking about right now. And as Esther said, yes, it's very important that now we are starting this conversation, because again, if we don't start this conversation and address it and really face the reality, then really it will continue to be business as usual. So let us continue. This is just the first part of this webinar series. Our plan is to have one every month. So there's going to be another one in July, another one in June also, and then even much later on. And each time, as already Anna indicated, we will also have specific sessions highlighting like country experiences on the ground, so that then we can really start to relate firsthand with some of these issues. So we look forward to welcoming you all in future webinars. And please, there are more questions coming. We will address them as we go along. And also, just to let you know that this webinar is being recorded, so it will be available, and we will share the link with everyone, so that you can continue to look, and especially also for those who are not able to attend for other reasons, maybe because of time. So thank you very much, everyone, and look forward to being together again in another month. Yeah. Thank you.